Hello, everyone. This is Jerry Hochek with Natural Awakenings Magazine and PlanetJersey.com, and I'm here today with Michael J. Goldberg of Manhattan Dental Health in River Edge, New Jersey. And your website is, what was it again?
ManhattanDentalHealthNJ.com.
Awesome. Thank you. And I just wanted to mention before we get going that Michael Goldberg is my dentist. He's my new dentist, and I'm very happy to be with him. I've gone through the whole gamut of what I thought were the holistic dentists or the whole body dentists, and I was always left a little dissatisfied. And not to downplay what these guys are doing, but my standards are very high. I've been publishing this magazine for about 4 years, and I've learned a lot in the process because I meet a lot of great people like you and others, and now I understand what a very high caliber of care looks like, and so that's why we're here today. I'm here with my personal dentist, Michael Goldberg, and so what does make you different? I mean, I have my own ideas because we've spent a little time together inside the chair and outside of the chair as well, and I want you to just tell people in your own words, what makes you special.
So I've had an interesting journey. It's been 40 years, and I know that
you're in practice 40 years.
I'm in practice 40 years, and I know that's hard to believe. I was the youngest.
Because you look young.
I was a bit of a prodigy. I was the youngest guy in my dental school class, and I was one of the youngest professors ever at the dental school at Columbia, where I taught for 30 years. So I've done almost everything there is to do in the field, but most importantly, and probably what sets me aside from most, is that I have this real inquisitive mind. It's something we share.
Right.
I want to know why things happen.
Again with the why. All right.
Again with the why. I'm a big fan of Simon Sinek.
Right. There's another podcast that we're putting out, and there was a large focus on why is it happening, which a lot of people aren't asking these questions. Well, what's behind what's actually occurring?
So my mother, God bless her, used to say to me all the time, "Why is a crooked letter?" I had no idea what that meant. But obviously, when I was a little kid, I was always asking why.
Right.
And she just got tired of it.
Why
I've always been like that. I want to know why. So over the course of my career, I was seeing things happening to my patients that didn't make sense. At first, I started practice near Columbia Presbyterian, where I was teaching.
And you're teaching. What was your title when you were teaching?
I wore many hats.
Professor, adjunct professor.
I was an associate professor of clinical dentistry. I was the director of the general practice residency program at Columbia Presbyterian Hospital. I was the director of the faculty practice at Columbia University. I'm sort of a chief and not an Indian, so wherever I was sort of the director of the program. So I've worn many hats.
That's great.
I've done lots of different things in my career. But early on, so this is just an example, I started noticing that the 30-something year-old people that I was treating who had braces, orthodontics, when they were teenagers, well, their teeth were crooked. And, I'm like, what's going on here? And so what I finally wound up doing was I went back to school to learn orthodontics.
Just because of that?
Yeah, because I didn't know why I was seeing what I was seeing. And that quest for trying to figure out why has sort of guided me to where I am now, and that does set me aside. So Manhattan Dental Health, both my office in Manhattan and here in New Jersey, the focus is on what's causing the problem rather than looking at the solutions to the problems. So you go into most dentists and you have a hole or you have a space, they fill the hole or they fill the space. I want to know why that hole got there, why that space got there, and more importantly, I want to know how to prevent it from happening again. If you don't know the why, you can't figure out how to prevent it from happening again. And it's a philosophical, I think.
Yeah, well, it's kind of common sense, I think. But
that's not how. So
But that's not how most of the world works. It seems anyway.
Right. So here I am. I was a professor for 30 years, and I taught students, dental students, hundreds, thousands of dental students, how to think this way.
Right.
And one of the things I've done is I've asked myself, well, how come we failed? Because most doctors get out and they don't think that way. And the reason is because our system is broken. Our payment system is broken. We don't get paid to think, we get paid to do. So you want to do stuff because that's how you make your money.
Right.
And it's reinforced by insurance companies. It's reinforced.
Procedures, right?
Procedures.
What are they? Hick-pick codes, or what are they called?
You get paid by code.
By codes. So how many codes did you do today?
No, it's not. But the codes represent different things. So, for instance, the codes that represent cognitive issues like examinations,
right,
do not get reimbursed nearly at the rate that procedures get reimbursed. So, and it's filtered into our entire system so that doctors don't go into family medicine anymore because they don't get paid for looking at somebody and diagnosing a problem. They're going into specialties like gastroenterology because you get paid for doing a colonoscopy. You get paid for doing surgery. Those are the things that the system values. Now it's changing a little bit. I went to a great lecture just a week or so ago in Philadelphia, and even insurance people are starting to realize that in the long run, that's costing us way too much money.
Yeah, even insurance people
are
and I was in that industry, and they're usually the last ones to figure it out.
No, they're even insurance.
And I love them, but they are usually the last ones.
So it's very interesting. Years ago, there was a company called Flying Tigers. Flying Tigers was a group of pilots who flew, I think, in China before World War II. Anyway, they set up the first Federal Express delivery system.
Really?
Yeah. As a matter of fact, they wound up being bought out by, I think, DHL, and so they are no more.
Kind of rings a bell. Flying Tigers.
Flying Tigers, great group. Yeah. They had a dental insurance plan that I had never seen before, and I've never seen since. The insurance plan said, "We will pay to have your dentistry done if you go to the dentist and have examinations twice a year. If you don't, we will pay you, but not at the same level. So we'll pay, for instance, 80% if you go to the dentist twice a year. But if you don't go to the dentist twice a year, we'll only pay 50%. Yeah. So what are they doing? The insurance company was encouraging preventive behavior. To me, that was great.
Because they were looking at some data, and
the data shows,
and it was speaking to them.
People who maintain their health. Look, it's the difference between sick care and health care.
Right.
We don't have a health care system. We have a sick care system. You get sick, you go to an emergency room, or you go to one of the dock-in-the-boxes that are opening up on every single corner, or you go to the urgy clinic in one of the drugstores.
Right.
They're not going to give you any preventive care advice. It's all sick care. That's a problem.
That is. But I think our readers are a bit more forward-thinking. They are spending that extra money out of their paychecks at Whole Foods, a lot of them, and because they understand the value in a healthier options. So this just falls in line. What you're telling us today falls in line with that kind of model of living.
Absolutely.
And well, here's something that I noticed. I was recently, my mother threw a little dinner party, and she had a bunch of her friends there, and you know, who I've known for years. They've been around for a while, and so they're all either in their 60s and 70s. And this isn't the first time I heard a story that from one of the gentlemen that he just had to pay over, I think it was like something like $25,000 because he had all these issues with his teeth. And I'm sure some of that, or why he arrived there, lends itself to him not being proactive and having those one or at least one or two exams per year. But I'm thinking, well, who the hell was this guy's dentist? Wasn't he guiding him along, kind of, you know, hey, buddy, you got to get in here. And I know sometimes you have to be the den mother, you know, because you know what kind of an impact it's going to have, instead of not like pushing, you know, certain patients to come in more often, because you can catch things early. I'm assuming you can catch things a lot early, and address them much sooner. So these smaller or seemingly smaller issues in the mouth do not become these $25,000 projects.
So that's a great point, Jerry. As a matter of fact, about 7 years ago, I had a defining moment in my professional career. I had a woman, probably similar to the woman at your mom's
Right.
dinner, whose best friend sent her to me. She actually sent her to me 30 years earlier. But when she sent her to me, she said, he's very talented, he's at the time quite young, but he's also very expensive.
This is in your Manhattan practice, I assume.
This is in Manhattan
Right.
practice. And so 30 years ago, she opted to go to her plan dentist. And she didn't want to have any out of pocket. So she went to her plan dentist and had been going for 30 years, doing everything that he asked of her, and even some cosmetic stuff that was out of pocket, because most insurance and most plans don't cover cosmetic stuff. But about 5 years prior to her coming to see me, things started not making a lot of sense. Her gums started bleeding a little bit. She was getting food caught in areas that weren't getting caught before, and even some of the teeth started getting a little loose. When she came in to see me, because she wanted another opinion, she wasn't satisfied. Oh, she said to the dentist, you know, this is what's happening. And the dentist said, well, you know, you just need to come in for more cleanings. And even though they were out of pocket, the additional cleanings, she came anyway. She went, she did exactly what he said, but it wasn't helping. So finally she came to see me. So she comes to see me, and I did my examination, and she came back, and I sat down with her and showed her, because I don't believe anybody should just believe me. I need to show people what it is that's going on. And I showed her exactly what was going on. It was going to cost her $60,000 to undo the damage that had been done over the previous 30 years. Now, she...
Damage?
Damage.
Damage by whom?
Well, so that was my reaction.
Okay.
So my initial reaction was I was angry at the dentist.
Okay.
And it was that anger, actually, that caused me to write my first book, What the Tooth Fairy Didn't Tell You. So, because I believe that the key to everything is education. So, but I was angry at the dentist. So was she. But I realized that it's not just the dentist's fault. It's the system's fault.
Right.
Because he was doing what the plan sort of allowed him to do. Now, yes, she had gum problems, and the gum problems caused bone problems, and the bone problems caused the teeth to shift. And we had to undo all of that. And we did. And today, she didn't lose a tooth. She's fine. She comes in. We undid it. And she's very, very, very thankful. But I was angry at myself. I was angry at myself because I didn't communicate to the woman who originally referred her to me 30 years prior. I didn't communicate the value that kind of approach really was worth. And that made me change the way I speak to people now.
But you were young back then, and you weren't all that experienced, right? So
absolutely,
you didn't come from that kind of a space yet of hey, you know what, I can prevent a lot of this.
Right, and that's the space that I'm coming from now. I see. You know what the biggest growth area of dentistry is?
I don't.
Implants.
Implants.
Yeah. Implants, to me, is an indicator that we've failed as a profession, because we couldn't let people keep their natural equipment.
Right.
We have to replace it. Now that's where the money is.
Sure.
I get that, but you know what? And we're starting to see it now. Actually, implants fail too. So if you had teeth that failed, what
about the underlying conditions?
Exactly.
Right. What about the bone, the gums? Right. And I mean, I don't know much about this stuff, but this is all common sense.
Right.
This is the common sense stuff you read in our magazine every month.
You'll see advertisements on TV for a group, a corporate group called Clear Choice, where all they do is take teeth out and put implants in. And it's $25,000 on a jaw. So if you needed both, that's $50,000. And they're advertising on television, which is maybe one of the more expensive ways of advertising.
Sure.
They don't even have an office here. Their closest office is in Baltimore. They are doing a bang-up business.
Sure.
Based on our profession's failures. So
right, and you know what? This isn't the first time I'm hearing this. In fact, one of the dentists that I was going to, I won't say too much about him. And no, I admire the guy. I think he's brilliant. He's totally brilliant. But one of the things that we were talking about when I was in his chair, because I'm a bit of a marketing geek, so we were talking about marketing, of course, and he had this idea because he saw another dentist doing it, but I think he was trying to wrap his head around the numbers. At that point, when I was his patient, he was trying to figure out, well, how can I do this? $1,000 implants, $1,000 an implant, put it all over the radio, right? Build it, they will come. Which is in line with what you're telling me. I if I had to get an implant, I don't think I'd go for the $1,000 one. I wouldn't, but you know what? It depends on my financial situation as well. But I don't want it to get to that point.
Exactly.
I want to keep my own teeth.
There's nothing
like your own teeth, your own hair, your own.
The studies show that people who keep their natural teeth live 6.5 years longer than those who don't. So by taking care of things, I mean, adding on 6.5 years to your life, that's a good deal. What's that worth to you?
Yeah, no, I don't want to be that old, but that's a different story. But I want good teeth until my last days. So,
you know what?
My own teeth.
Exactly.
Right.
Exactly. And there are ways to do it. But first of all, it takes two to tango. So I was angry at the dentist. But here's one of the things that I realized. When I was in dental school, and even in most dental schools today and in most dental hygiene programs, we're taught about how nutrition affects the health of your mouth and your gums and your teeth. We're taught it. As a matter of fact, in our clinic, and I went to Tufts in Boston, you actually had to go through a whole diet analysis. If you were a patient, you had to go through a whole diet analysis before you were able to have any treatment done. It was that important. I don't think most dental schools do that, but the fact of the matter is that dentists are trained to discuss diet and the effect. Yes, they are. And the effect of diet on not just overall health, but in particular the mouth.
Oh, but just about every dentist?
Every dentist.
Has some of that. It's part of the schooling. Okay, so and how many, now think about this, readers or whoever's listening to this. How many times has your dentist discussed your diet with you? Now, my first and I didn't even think it was anything, that special, but it is, because but I'm already kind of in line and gear with all this stuff. And when I first went to see Michael, my first appointment, we talked about my diet and my lifestyle outside of that. And I had to answer I think it was about 200 questions prior to even seeing him on an iPad. And he wants information. He wants to be empowered with his information. And I just want to add this because Michael doesn't focus too much on promoting himself, but state-of-the-art office in River Edge, New Jersey, right off Route 4, near that huge wine store. So if you're coming in for wine, what the hell is it called?
Total Wine.
Total Wine. You gotta get the wine stains cleaned off your teeth. But afterwards. But
I should go put cards there. I guess.
Not far from Route 17, 80, Turnpike, George Washington Bridge. There's a heliport somewhere near us, I'm sure. If you want to fly in, because he does have people that are coming in from, for his Manhattan practice especially, because he's been there I don't know how many years, but how many years?
Almost 40.
Almost 40. He does have people that come in from, some of them come in from out of the country even because of his reputation. So I want to illustrate the gem that we have right here in our own community, and I'm not. This isn't exaggeration. I mean, I understand, and the level of care that you're going to experience here. I don't think you'll be able to really compare it with any other that you've had prior. The staff is fantastic here. They're friendly. They're very accommodating. And it's just a good energy, a good vibe. I'm happy to be here. I'm just happy to be in this space whenever I come, even though I'm coming to the dentist, which isn't the place we always, or the one of the top 5 places that we want to be, in throughout the year. But anyway,
so that's that's also interesting, because I think that a lot of us, myself included, as we grew up, had less than positive experiences in the dental office. And, the media does not portray us in the best of light. I'll never forget Marathon Man.
And they say you guys have a high suicide rate.
Well, that's actually not true. They've debunked that.
Okay, good. I want you around.
Good. Yeah, no. So, we got away from the nutrition.
We did.
It's such an important. Part.
And it is right.
So dentists learn about nutrition, and how come they don't incorporate it into their practice?
I don't know. How come they don't?
Because insurance companies don't pay for it.
So they don't pay for these kind of consultations.
So they don't pay for a diet. There's a code for it, because the American Dental Association, which makes the codes, has a code. So because they know what should be done. But insurance companies don't pay for it, and it's certainly, even the ones that might, they pay for it at such a low rate that dentists don't believe that it's worth their while to do that. So they don't talk about it. But we know, because, and this is the other focus of our practice, is that we now know how connected the mouth is with the rest of the body. And again, you say, oh, that makes sense. The mouth is part of the body, but it's never been treated that way.
Right.
It's been treated as a separate entity. But we now know, studies after studies are now showing that what happens in the mouth doesn't stay in the mouth. The bacteria that are in your mouth don't stay in your mouth. They go into your blood system, and they can affect your heart and your pancreas and even your brain. So the relationship between oral health and overall health and wellness is well established now. So there's a paradigm shift that's happening, but it's happening very, very slowly. And that's part of my quest. It's my mission is to try and educate people that, what you asked the question, when was the last time your dentist asked you about nutrition? Well, I'll ask a different question. When was the last time your physician asked you about your mouth?
When was the last time your physician asked you about nutrition?
Well,
unless you're going to maybe somebody that's advertising in the magazine or your own alternative, complementary, whatever, integrative medical specialist. We have some great MDs out there that are very integrative now. And so a big part of it. I mean, I had to go through a radical diet change.
Yeah, me too.
I didn't want to.
Me too.
But I got my ass kicked.
That's right.
And I was looking at my diagnosis, and I was like, well, I can continue down this path, or I can cut out all the carbs and sugar and all the other debaucherous stuff I was eating, and maybe have it once in a while on a cheat day, but I did it. I mean, I'm no spring chicken anymore. So my body's less resilient. When I was I'm still kind of mentally in my 20s, right. But that doesn't work with this body that's cresting 50.
Right. So that's
I had to take responsibility for my own health.
So that's the problem. Maybe we can talk this out a little bit.
Sure.
Because when you're young, you think you're invincible.
Yeah, I still do think I'm invincible, but my body doesn't.
Right. So your mother's friend, who had to spend $25,000, experienced the problems that probably started 25 or more years ago.
Sure.
How do you convince a younger person that it's in their best interest to have the kind of care that we know is in their long-term best interest?
How?
That's
how about preventing the scenario where you have at age 55 or 60 or 65, you're going to have to pull out 25 grand out of your pocket unless you have or your bank account, unless you have a very good plan, and I don't think those plans really exist these days. For $25,000 worth of work, let's say within a 3 to 4 or 5 month period, right? Because these are projects.
Oh,
these are projects.
Some of these projects can take years, actually.
Yeah, I believe that. Yeah, right.
So it's still, like I said, it takes two to tango. It's not just the healthcare practitioner, it's the patient as well. So people have to demand that kind of care. It's interesting. So dentistry in the 90s made a lot of money on cosmetics, but it wasn't the dentists that were promoting the cosmetics. It was television shows that were showing these extreme makeovers.
Right.
That's what fueled the whole cosmetic industry. So dentists are not fast to change, and physicians aren't either. It's a very slow-moving, slow-adapting profession. It takes the public to get to demand that kind of care, which is why what you're doing is so valuable, because you're doing, I think, exactly what is necessary. You're educating the public. I don't.
We're educating the public.
Absolutely.
We are, right.
And that's what, what? The word doctor is from the Latin that means teacher.
Really? Didn't know that.
That's what a doctor is really supposed to do. He's supposed to teach people. And
how to maintain good health.
Exactly.
I would assume, right?
Absolutely.
Okay.
Absolutely. So,
When he's not busy scribbling into that pad.
Don't scribble into the pad. Don't use the pad. Now
Step away from the pad.
Now it's all on the internet.
What the pad is it? What is it?
Oh yeah, we prescribe, and it's not here in New Jersey yet, but in New York, We don't use pads anymore. It's all on the internet.
Oh, that's right. That's right.
E-prescribe.
That's right. Yeah, I'm old school, I guess.
Well, that's because one of the biggest, one of the biggest problems today is opioid addiction.
Yeah.
It's a huge problem.
I know all about it. I actually helped a friend get off.
So
5-year addiction. Single-handedly got him off.
So how do you know how you know it's a real problem? You know it's a real problem because on television there are commercials for opioid-induced constipation.
Oh yeah. Oh, I know about that. Yeah,
Right.
My buddy told me about it. Yeah.
So I'm saying,
Yeah.
is this a big enough problem that they actually advertise for drugs to treat the symptoms that are, the side effects of the problem? So the answer is yes, it's a huge issue. So doctors are writing a lot of prescriptions, and now the government's coming down really hard on it, which is good, but that's a symptom. The cause of the problem, partly, again, it's cultural. We're demanding quick fixes.
We've been anyway.
We've been.
I think now we're starting to see the light.
So
a little
again,
bit. Starting.
People who are reading your magazine are obviously looking for an alternative.
Right.
And
others as well.
And they're there.
Yeah.
I mean, look, you mentioned the sugar business.
Right.
I mean, one of the things we know about sugar is it lowers your pain threshold. So you feel more pain when you are eating sugar, you're feeling more pain than you would otherwise when you're not eating sugar. It's a chemical response in your system.
That's interesting.
So you can be more resilient to pain if you get off sugar.
Wow. Nice.
Well, again, it's to me, diet and breathing.
Diet's huge.
Well, I think breathing is actually even bigger because you can live without eating for a couple of days. You can't live without air for more than 4 minutes.
How should we be breathing? That belly breathing?
Nasal. First of all, it has to be nasal breathing.
In through the nose, out through the nose.
In through the nose, out
Always.
through the nose. Buteyko breathing is a great thing to study. Dr. Buteyko was a Russian physician who developed this system to basically combat asthma. And there's a great book by Patrick McKeon called The Oxygen Advantage that goes into all of this. And breathing, we ask our patients about breathing. It's a big deal. Because if you don't breathe through your nose, where are you breathing from? Mouth. And if you breathe through your mouth, you're not getting the advantages of nasal breathing, which are filtration, humidification, and it warms the air. So people, for instance, who have asthma have often something called cold-induced asthma. When they breathe in cold air, it irritates their bronchioles,
right,
and it encourages asthma attacks. Well, the easy way of doing that is warm the air. So, when warm air isn't as irritating as cold air. That's just the way we're meant. The other thing is that, nitric oxide is actually produced in our paranasal sinuses. So if we're breathing, and everybody, well, maybe people don't know what nitric oxide, but nitric oxide dilates your blood vessels. It makes oxygen go back and forth easier in our system.
I know about that, yeah.
Nitric oxide is one of the cures for ED.
It's good for, I was going to say it's good for men because I read
That's right.
Right.
That's right. Nitric oxide.
I read the medical information on one of those particular drugs.
Right. You want a natural cure? Breathe through your nose.
Right.
Read the book, The Oxygen Advantage. It's a great book.
Yeah. Okay, good. Because I'm glad you brought up the ED because I was thinking that, and I was going to say, it's great for men too, that nitric oxide.
And sleeping's a big deal too, because lots of people have sleep disordered breathing. Mm-hmm. Right. So it's all connected. Mm-hmm. It's everything's connected.
And not engaging in mouth breathing just makes you look classier, I think. as like a side bonus.
It's a great story. So on my bucket list has been skydiving.
Okay.
So for my last birthday, which was just a couple of weeks ago, my daughter, son-in-law, and grandson bought me an indoor skydiving experience. So we went on Sunday to this place in Yonkers.
Yonkers.
It was great. It was fantastic. But
he's lighting up. He's really lighting up. Do we know the name of the place? Do we want to give him a plug?
I
Fly in Yonkers.
Yonkers. Right off the thruway.
All right, I'm going.
Chill.
I'm going. We're all gonna go. We're gonna do a community trip. We're gonna pack some buses.
Fantastic.
All right.
And you don't have to jump out of an airplane.
Nice.
So, but when they have groups, and you get to go for a minute at first, and then you go another round and go for another minute. And it was this one little kid who you're in a suit and you're in a helmet and goggles, and this kid obviously couldn't breathe through his nose. And his mouth was open. When he got out of the chamber, he was all full of slobber. Everyone before was giving people high five. Nobody wanted to touch this kid. But the fact of the matter is that I can predict that kid is going to have healthcare problems.
Sure.
Because this kid cannot physically breathe through his nose. He has to breathe through his mouth. And again, one of my missions is to educate physicians, OBGYNs and pediatricians, ENTs, who see these kids when they're really young, to get to them so that they don't grow into their mouth breathing. And you take care of the nasal breathing earlier on, and it solves a whole bunch of healthcare issues. And there are ways to do it. I'm now doing it with my grandchildren. Two of them are mouth breathers. And you can see, go into your child's room at night and see how they're breathing. And if their mouth is open when they're breathing, there's a problem.
Mm-hmm. And what sorts of issues or problems could we see from mouth breathing? Just to touch on a few.
Well, there's asthma.
Really?
Much higher incidence of asthma.
Because there's not that filtration that's occurring,
right.
So there's more...
it's chronic irritation.
Right.
We know that chronic irritation is a bad thing.
Sure.
Well, when you're not breathing through your nose, you're chronically irritating your lungs.
Mm.
All right? So all kinds of lung problems can ensue. You're dry. Your mouth is dry. Well, if your mouth is dry, you're going to get more cavities. I mean... Your saliva is your body's natural, it's how we're built. It's your body's natural defense against both gum disease and tooth decay. So there are all kinds of things that are, it's not just the mouth. Like I said, it's the lungs. Your heart is working harder. If you're not getting oxygen through your system, your heart has to work harder. So you're going to have more, chances are you'll probably have higher incidence, a higher chance of getting high blood pressure. Hypertension, which is the biggest cause of stroke. There's all like I said, everything's connected, and the seeds are started when you're really young. So parents have, I think, an obligation to educate themselves as to what these options are, so that they can take care of their children who are dependent on them.
So what we're doing really, especially with the whole dental model, or what we should be doing, is we're preventing, well, in this case anyway, with the breathing, if we catch it early with the children, we're avoiding perhaps decades and decades of detrimental habituation.
Right. So that's a great point. So there are people. So you have a little kid. Mm-hmm. Who has chronic ear problems and tonsil
ear
problems.
infections. Big deal. Big deal. Very common these days.
Never a problem when we were kids, right?
Never. No.
Right.
No, never.
Now it's a big problem.
No. But I played in all kinds of swamps and dirt.
But you still never had a problem.
No, because my body built up immunities.
That's true.
Yeah. Newark Bay. I'm from Bayonne. I mean, that was nasty back then.
So, but the point is that kids at that age get used to breathing through their mouth. So even if they physically or mechanically can breathe through their noses, they've habituated to breathing through their mouths.
Sure.
That's why, but you can unlearn that.
Right.
And he goes into it.
It's easy, I'm sure.
He goes into it.
It takes a little doing.
Changing a habit takes doing. It's work. So, and he goes into it in the Oxygen Advantage.
Interesting.
It's a great book.
Okay, so again, because what's the word? I'm gonna, I guess, cut some of this out. So I don't know how to word this. So you're not always the best person to promote yourself, and because you're a bit right, and because
that's not my raison d'etre.
That's not the hat you wear, but so I'm bringing that up because in your own words, I mean I can look. I published this magazine. I could spew off 150 reasons why, but I'd rather you tell the readers or the viewers. Why Michael J. Goldberg should be their dentist? Because I don't know you that well, but I know from what I've seen and heard and experienced so far, I'm very happy to be under your care.
Right. So, and then that's the rub. I mean, because you won't really see the benefits for years down the road. But the idea of having the kind of care that is predictable, sustainable, that allows you to stay healthy with minimal investment so that you don't get to a point where you have to spend those big amounts of money. That's the kind of care that you don't find everywhere, unfortunately. And you're right. This isn't about me. This is about educating the public. I opened the office in New Jersey, specifically because I could have stayed in Manhattan, but I really don't know anybody in New Jersey that is practicing this kind of care.
I don't either, and I've seen all the top ones. Right. I've seen all the top ones, and that's why I'm your patient. Or to expand on this a little bit, why see Michael Goldberg? And here you and I had this discussion where most people are I would think anyway. Most people are relatively happy with their dentists, and they continue to go to them. And change is tough. Let's face it. Nobody wants to change things unless they really, really have to. What you're offering is a whole kind of it's a different package, or it's a different presentation. It's a different way of dealing with the mouth and everything else that's connected to it, which is the rest of the body. And I like the preventative angle. And I think a lot of us are already doing that with our bodies, and that's why we shop at places that have organic food, and we read magazines like Natural Awakenings, and we're also consuming lots of other information out there, and we're figuring out what's also going to work for us the best. But I want to stress the fact that maybe you've never or our readers have never experienced a level of dental care such as this, and they need to. They need to kind of experience the difference, and maybe even get second opinions on some of the stuff that already might be occurring with some of the readers out there. Just come in and have a pro, have an educator, have a professor, have a former director, somebody who's been in practice for 40 years in Manhattan on Madison Avenue, and I think you were in some other locations before that.
Yeah.
In Manhattan.
All associated with Columbia.
Have the creme de la creme of dentists come and take a look at that mouth, and it could prevent a lot of expenditures down the line.
You asked a great question, and the question was why? Why should somebody get out of their comfort zone?
Right.
And go, and I think if you've gone to a dentist who hasn't discussed diet, if you're having any kind of problems, or if you're going to a dentist who hasn't discussed diet, who hasn't discussed nasal breathing versus mouth breathing? Who hasn't discussed headaches, which is another big area? Who hasn't discussed doing a specific bacteria profile on you to determine exactly what kind of bacteria you have in your mouth? These are all things that are pieces of the puzzle that make up not just your oral health, but your overall health. And we now know that these little things all build up to sometimes cause big problems down the road. So yes, you may not have the issues now, but you don't want to end up like your mom's
friend,
like your mom's friend, and all of a sudden be faced with a $25,000 bill or worse.
Especially at that age, I don't want to.
Well, so that's,
I don't want to spend $25,000 when I'm that age and I'm looking to maybe spend it in the Bahamas or wherever.
So
or Maui.
So that right. So that's sort of the end of part of that story of that woman who came to me, who needed to spend $60,000. She sat down in my chair and she cried, and she said, I just retired, and I didn't budget for that. And I felt like crap. I mean, I really felt terrible. And that's really that was a pivotal point in my career. I really sat down and reevaluated how I present things to people. So I will now discuss with a 20-year-old these same kind of things, because I know that these things are important to this person when they're 60 years old.
Right.
They need this information now. It's going to save them a lifetime of aggravation and a life in expenditures of money
and time.
When they don't want to. You're right. They want to go on safari. They want to
go to Miami.
Maui.
Sit around and drink fancy drinks, right?
Exactly.
Yeah.
As you should.
Sugarless fancy drinks.
You work really hard during your life. You should have the health to enjoy it. And that's what that, like I said, people when they're younger think they're invincible, and
that's right.
Those of us who've experienced breakdown of some kind will do anything we can to undo it and prevent it from happening in the future. Yeah. Those of us who are young and who haven't experienced the breakdown, I think it's an education process, and certainly it's up to parents to guide their children into those into that philosophy of life, and it is a life philosophy.
I think so, and I think a little education could really go a long way, and that's the reason that we're bringing this to you. This is coming at you from more of an educational standpoint, because I understand who the readers are in this magazine, and I thought that instead of reading, why don't we bring them some podcasts that they can listen to in their car while they're driving to work or whatever, or a yoga class. I want to thank you for taking the time and coming in and doing this with us today. And if you want to check out the website, it's Manhattan Dental Health NJ.com, and it's Dr. Michael J. Goldberg. Thanks for coming in.
Thank you. Pleasure, Jerry.